I think it's been a while since I've talked to this guy. Brian, how are you from the Sarasota County Department of Public Health?
Jay, we're keeping busy, and I'm happy to be in.
Yeah, I think last time it's been almost a year, Brian, since we've talked, and this is when this whole thing got underway, and we were talking. You were actually in the studio, and we were talking about this COVID-19 coronavirus that's been going on for almost 11 months.
Yeah, I was just thinking about that this morning. Yeah, it's been 11 months we've been really active in this.
Yeah, so tell us where we're at now today with the Department of Public Health here in Sarasota County, or at least in the North Iowa area, compared to where we were 11 months ago.
Oh, goodness gracious. We've been doing an unbelievable amount of documentation, and someday we'll have to circle back on this. I mean, March 8th, when we received first notification of a positive case in Iowa. But even before that, around, mid-January, we were talking about what was happening in China and how we get ready and start planning for this. I mean, public health and our first response partners were sitting in the basement of the police department talking about what this is going to look like. And to go from there to here, it's pretty remarkable, especially when you think about the fact that, for the first several months we were talking, and I said it, I didn't think we would ever see a vaccine within, most likely, I thought 18 months was unbelievably optimistic. And I felt 2 years or more was going to be realistic. And here we are 11 months into this, and we're fielding a lot of phone calls for some vaccine process, trying to get people signed up that we're trying to make that system better, but we're getting people in. We are doing vaccine, and so I look at the big picture and I feel like we're pretty lucky. We're extremely lucky that we have a vaccine that is here. We're administering it even in small quantities, but that's better than needing to wait another year before we have it.
Yeah. So with everything being released, the federal government, they're releasing things to states differently. So how does it break down statewide as far as the determination of how many we get here in like the North Iowa area?
Yeah, so the governor's talked openly about this. The state of Iowa receives about 19,500 doses of Moderna vaccine every week. Now, Jay, we got 3.3 million people here and 99 counties. And if you divide 19,500 doses just evenly by, 99 counties, that doesn't go very far.
Right.
And so it's just the expectation needs to be realistic throughout Iowa that it at this current rate, it's going to take a long time. Now we anticipate, and it's very likely we're going to see an increased number of vaccines available because we know that we no longer really have to share with long-term care centers because the doses have been either administered or they're basically in the freezer being ready to be distributed to residents and staff at long-term care centers. So those vaccines that were being held back in January will now be disseminated to the general public in Iowa. And so the Pfizer vaccine will be added to the Moderna vaccine. So we should start to see about 38 to 40,000 doses each week. Again, that doesn't go very far when you're talking about 99 counties.
Sure.
But we're hoping that those numbers will start to increase and we can offer additional time slots and services and start to get more people in.
So do they come in on Mondays? They come in on Fridays? When do people have to get signed up? Because I know you had the first round here recently that was being distributed.
So what we say is anytime we get a process kind of standardized, it seems to change. And this is another classic case. We were originally notified either Monday or Tuesday or Wednesday, early in the week, that we would receive an allocation for either later in the week, so we would receive it a few days later, or early the next week.
Sure.
Well, again, that changed last week. Now we're notified on Friday that vaccine allocations should be shipped the next week. And so when we receive those allocations, then that's when we go in and start setting up those time availabilities for people to go in and sign up. This week was the first week we've tried that with the general public. And again, it's pretty hard to try to get I know that there's just a shade under 10,000 people in Sarasota County alone that meet the 65 and over age category. And to try to get all of those people calling in at the same time for 200 doses, which is all we have,
Right.
uh, it's just a, I mean, it's just a train wreck waiting to happen, and we know that. But we want to be fair, and we want to give everybody equal opportunity to be able to get signed up. And so
Right.
it's too many people trying to sign up at one time for so few doses. And anyway, with that said, we're working on things that we can do here to try to make that process easier, simpler, just more realistic going forward, and we'll keep the public updated on what those changes will be.
Yeah. So people don't know where to go. Where do they need to go to get signed up for it? They can't just show up at the office and go, "Hey, I'm here for a shot."
Yeah. So people, what we used this week for the first time, we actually sent out a code red last Friday, and the code red is obviously the notification system that we want people to sign up on.
Right.
Now, we know we've received some calls that people think that they actually got signed up for a vaccine because they signed up for a code red. And I think that's really important for people to recognize. Just because you signed up for the code red you don't have a scheduled appointment. That scheduled appointment is, there's a different step in that process to be able to go in and sign up for those time slots. This week we did it. We went live on Monday morning.
Mm-hmm.
For the 200 doses. People could either log in through a link that we provided, or people needed to pick up the phone and call in. Again, we had a huge volume of calls and a huge volume of people trying to access our website, and just too few vaccines. The problem all boils down to how many vaccines we're receiving, and
Right.
without an adequate, abundant amount of vaccine, this is what these are the cards we're dealt.
Now, do you have to get anything from the doctor at all before you can sign up for this, or you go, you know what? And the other, not only the doctor's signature, but how about if you've had it? How long do you have to wait if you've had the COVID or Corona?
Yep.
How long do you have to wait before you can get a shot?
So first question, you do not need a doctor's signature. So this is going out to anybody who we can give it to. And how long should you wait? I think that's a great question. The federal government has said that people have antibodies built up in their system if they've been positive for COVID within the last 90 days. And so if people have had recent COVID, let's even say in the last month or 60 days, we would ask people to maybe hold off and let some of those other people who have not had COVID access the vaccine first, because again, there's natural immunity built up within people for, again, that 90 days. I think there's a lot of discussion about extending that out to 180 days, but I can't say that we're there yet.
Right.
Again, things are constantly changing, and there's a lot of science that is still being done to try to research this virus and how it impacts people and how it should be responded to. So 90 days. What they do say also is if you've had it, you should wait at least 14 days after your quarantine period is up.
Okay. I got a question that came through here, Brian, that says, here, I'll pop that up at a question. Should pregnant women get it, or should they not get it? Just wondering.
It's a great question, one that we get often, and it's one that I feel that the vaccine manufacturers have left rather vague as far as guidance for how it should be, how women of childbearing years or pregnant women should proceed forward with getting vaccinated or not. I think it just boils down to the vaccine was developed under an emergency use authorization. There wasn't enough time really to do the research for other certain populations. And that might mean that includes pregnant women or women who might be looking to have children. And so what the guidance states is that women should have a conversation with their doctor and make an educated decision based on their consultation as far as maybe other risks, other concerns, and let the doctor and the patient make that decision. And so I would say that is the step that people should take. If you're pregnant, by all means, talk with your doctor. If you are wanting to have kids, talk to your doctor before getting that vaccine.
Now, a lot of people with this, you see things on the TV and the news about school. A big thing now is the issue of schools, going back to school. I think a lot of people around here are in person school, correct?
That's correct. Yeah, the governor is looking to really push this issue. And to be quite honest with you, I like being wrong, Jay. And early on in the discussion, I said, when we put kids back into the school systems, it was, and this even goes back into March and April. If we have kids in schools, it's going to be a mess of a lot of COVID cases. And I was completely wrong. We know now that because kids are in school in a place where masks are generally mandated, for the most part, as far as I know, all of our schools in the area require masks indoors, and I think the governor has an expectation in that sense as well. That we know that the masks work because if kids social distance and they're all wearing masks, we just haven't seen the spread of COVID in the schools. And again, I think it makes a case for the general public. We should be mandating masks in public, at least indoors.
Yeah.
Because the science is there. It helps control it helps control spread of viral activity. And if you note, I just said viral activity because the other thing that public health agencies are watching for is where are we at with our flu? We're seeing really low numbers of flu. And we think it's because of the physical distancing. It's because people are washing their hands more. And honestly, people are wearing masks.
Mm-hmm. But, and I'm going to bring this up because I know I've heard it, and maybe you have too. People say, well, the numbers of flus are down because they're putting everything under the COVID numbers. Have you?
I mean, that's not true, because what happens is when you go in to get tested for COVID, especially during flu season, a lot of times they're testing for flu anyway. And so the testing, it's not like the testing is absent. Testing is happening. Again, the cases just aren't there. And so, yeah, I've heard the same theories, Jay.
I know. He's got to make you just scratch your head. What people are, what they come up with. Because some people you talk to say it doesn't matter with the masks. It does matter with the mask. A lot of places, like you mentioned, the schools, they do a great job of that. Kids are learning to adapt and live with it that way. You go out to eat. I saw something today. We were talking about how we weren't, but I saw it on the news that they were saying that in restaurants, because they're wondering about when things are going to start to open up a little bit more, because they say the restaurants are 1.4% of a spread. The main spread where it comes from is mainly in the home of about 73% is where that's coming from.
I haven't seen those statistics, but I mean, I would say that's realistic. I mean, people are picking it up from somewhere.
Right.
And I think that, you can pick it up in a lot of places. But anywhere for that matter. I mean, it can be even aerosolized. It can hang in the air for a period of time.
Sure.
And so, I mean, it's super contagious. And the one thing we haven't talked about is what's going on around the world with some of these new variants. And so we know that there are additional variants out there in various parts of the world that are more contagious, so they spread faster. The question is, do they make you more sick? And I think that jury's still out yet, but we definitely know that that some of those variants, especially the one out of the UK that we actually just identified in Iowa, are definitely they're definitely here, and they definitely spread faster.
Well, you would think that, because you think about it and why it's not spreading in certain spots, and that's why some people are wondering about opening things up a little bit more with the mask, because they can. You see people, they're wearing masks in restaurants, they're wearing masks at the gym, they're wearing masks at school, but at home you don't wear a mask. So that's where it would spread. And if you are, you're supposed to stay home if you're sick anyway. So, but it's just kind of interesting on how everything's going. But I think people are doing a good job and finally just, adapting to what's going on right now.
Yeah. The question that we get a lot is, okay, once I get vaccinated, do I need to wear a mask? And the response to that is absolutely. when you're out in public, we're going to need to continue to wear masks probably this time next year. It's right now, until we get vaccine really distributed to large numbers of people, we're going to need to be wearing masks and continue to follow all of these general rules. Wash your hands, physical distance, stay home if you're sick, which should happen anyway. Cover your cough, all of those good public health points that we've been talking about, people will need to follow, but mask utilization will be key.
Yeah. So let me ask you, have you had it? Have you caught the coronavirus?
I have not. I've had members of my family who have, but again, we follow the rules even in our own home, and I didn't get it. And so I really play by the rules, Jay. I mean, I try to practice what I preach.
Right.
I try to keep my distance. I try not to go out. I try to, I go get groceries and things like that. But when I go out, I've always got hand sanitizer with me and make sure that I'm cleaning my hands after I touch anything else. So I think I'm fortunate. I'm happy about that.
Yeah. Yeah. Because it's strange, because I by myself, I haven't caught it either, but I think I may have had it. And again, this goes totally against the antibodies that you get, but I think it was back in December of 2019 that I had it. By now, my antibodies are probably gone, but I was fortunate through 2020 that I know of that ever came down with it.
Yeah, it'd be interesting to see if you have antibodies still. I gave blood a few months ago, and I'm coming due again, and they automatically test your blood and tell you your results are. I did not have antibodies, so I know that I haven't had it, but I haven't really been sick either. I mean, I haven't noticed any symptoms, but again, people can be asymptomatic.
Right.
We get cases all the time with people didn't know that they were sick. They happened to be tested for whatever reason, and lo and behold, they're positive.
Yeah. But if you're asymptomatic, do you still have the antibodies?
If you're asymptomatic and you come through it and you didn't know you were sick, and all of a sudden you get blood and you get notification that you have antibodies, yep, you'll have antibodies. And I've heard of people doing that. And they're like, I had no idea that I was sick until I gave blood, and they told me I had antibodies built up.
Huh. Yeah. Because my wife just recently, last Saturday, set up an appointment. It cost like $25 to go get tested for the antibodies. And she went and got tested Saturday, and it came back that she's negative. So she either hasn't had it or had it, but she hasn't been sick either. So it's kind of interesting on how the whole thing, I don't like going to the doctor, Brian. So to go get my finger pricked just to see if I got the antibody, I'm one of those guys, I don't want to go.
Yeah, you know what though? You have to look at it like it's good medicine, and to have an idea of whether you've had it or not. It's no matter. We've got vaccine coming out. The message we're just telling people is public health around this state. We're working our tails off. We're trying to do things right by people. We're trying to, we're trying to get things situated so people can get the vaccine. We're trying to get the message out that we will get more doses. We will get more vaccine. And just because somebody doesn't get in this week, they might get in next week, or they might get in the following week. Again, it's still a year ahead of where I thought we would be. So just asking for people to just be patient with us. We're trying our hardest. We're working to make the process as easy as possible. And, we'll get there as a community. But again, just need to be patient. We only receive a very limited number of doses, and we try to get those out as quick as we can.
So again, just to kind of recap, just the two websites that people should be going to is the code. Is it codered.com? Is that what that is? Or
well, we've got a link on our website. So cghealth.com is the only thing they need to do is go to that website and sign up. We've had some calls about people who've signed up and then want to unsign up. Because either they got in or they don't want to get the notifications anymore. And what I would tell people if they haven't signed up, the Code Red is not the only way we're going to put information out about the fact that we've got vaccine available and people can sign up. We also put it out on our social media. We also put it out through our Facebook page, which is social media. I meant to say our website and our media partners. So we'll put that information out. People don't have to be on Code Red to get that notification. Again, Code Red will be put out generally a few days ahead of time, so people have time to arrange to be able to try to be, in a situation that they can go in and try to sign up. Eventually, we hope that, sign up will just be a piece of cake because there's going to be slots open all the time.
Sure.
If we start getting a few thousand doses at a time, then it'll be much easier for people to get signed up. Right now, it's pretty tough to do this when we get 200, 300, 400 doses at a time.
Yeah.
The good thing that we know, Jay, is we got people who want to get the vaccine. So that's good. It's out of our control to get more of it.
Yeah. Sir, go to in general, though. I mean, the North Iowa area numbers going down, though, correct? I mean,
I think I saw 7.3% as far as our rolling 14-day average. And I think our days to double got to be up well over 80, 85 days. So back in November 13th, we were at 19 days to double. And our 14-day rolling average was in the mid 20s. So we're doing pretty well. I'm happy with where we're at and the progress that we've made.
Excellent. Well, sounds good. Well, Brian, again, I appreciate you taking the time to talk to us here on the Neighborhood News, brought to you by Shook Eye Chevrolet, just to get people updated. Because, like I said, it's been a year since we talked about the pre-COVID, so to speak. I guess we talked, but
yeah, happy to help get the message out. Try to keep the public informed, let people know what's going on, and maybe we can get back here again soon.
Yeah, absolutely. So don't be a stranger. We'll try and do it maybe the next 6 months.
Yeah, for sure. Well before then.
Yeah, exactly. Well, thank you.
Jay.
Thank you again, Brian.
Take care.
CG Health. Thank you very much.
Bye now.